Hello, Dr. Goss. My final case presentation will be on a 46-year-old Hispanic male who came into the clinic for a follow-up of his diabetes. He has not been to the clinic for a year and has not taken any of his medications for a year because he said he feels fine. He has a history of type 2 diabetes, mixed hyperlipidemia, and gallstones. He presented to the clinic with no complaints. The following video is a simulated examination of this patient. Good morning, sir.
Good morning.
My name is Maria. I'm a nurse practitioner student. I'm working with the doctor today. And if it's okay with you, I'm going to go ahead and talk to you first and examine you first. Is that okay?
Yes.
Okay, let me just go wash my hands first. Be right back. So it's nice to meet you. Okay. Okay, sir, so I'm reading your notes here that the medical assistant put, and it says that you're here for a follow-up for your diabetes. Is that correct?
Yes.
Okay, and it also says that you haven't been here for a year now, and the last time you were here is because you had some dizziness with your metformin, and it looks like the doctor changed the metformin to glipizide during that visit. Is that correct?
Yeah, that's right.
Okay.
But I haven't been taking the medication though since then.
Oh, okay. Have you been taking your other medications as well?
No.
Okay. Why have you not been taking your medication, sir?
I've been feeling okay, but so that's why I've been taking it.
I see. Okay. Do you follow a special diet for your diabetes?
No.
Do you exercise regularly?
No.
Okay. And do you ever check your morning blood sugar, sir?
I do. Usually averages between 130 and 150.
Okay. And do you have symptoms where you feel like your blood sugar would be low? Like you're drinking more than usual,
No.
peeing more than usual, eating more than usual? No? Okay. Okay, so I'm just going to go over a list of symptoms and you just let me know if you have them. Have you been recently ill?
No.
Fever, chills, or fatigue?
No.
Okay. Any blurred vision or changes in your vision?
No.
Okay. Any chest pain, palpitations, feeling short of breath when you're laying down flat?
No.
Okay. Any problems breathing or cough?
No.
Okay. Any abdominal pain, nausea,
No.
vomiting,
No.
diarrhea, constipation?
No.
Okay. Any problems maintaining an erection during sexual intercourse?
No.
Any burning with urination?
No.
Any rash or lesions or
No.
masses?
No.
Any discharge?
No.
Do you find yourself getting up at night to have to use the restroom?
No.
Okay. And do you have any fainting episodes, dizziness,
No.
any numbness or tingling or burning sensation to your body?
No.
Okay. And any stress?
A little bit of stress at work.
Okay. Any thoughts of hurting yourself or others?
No.
Okay. Okay, so I'm just going to review your past medical history to make sure everything's current. It says here you have type 2 diabetes, is that correct?
That's right.
And just to confirm, I'm going to go over your medications and just to confirm that you haven't taken any of these. The glipizide,
No.
how about the Onglyza?
No.
The lisinopril,
No.
and looks like fenofibrate.
No.
So you haven't taken any of those medications for a year.
No.
Okay. So see, it says here that you also have high cholesterol, correct?
Right.
Yes, and also that you have problems with gallstones?
Yes.
Okay, and how's that been going for you?
Get pain every once every while, every 2 to 3 months.
Okay.
Around that time, but it seems to just go away on its own.
Okay, good. Any allergies to any medications?
No.
Any allergies to any types of food or substances?
No.
Okay. And do you have any psychiatric history, sir?
No.
Any history of any injuries,
No.
surgeries,
No.
hospitalizations?
No.
And do you drink alcohol?
Just socially, just have 1 to 2 beers.
Okay. And do you smoke?
No.
Do you use any illicit drugs?
No.
Okay. Okay. So I'm just going to review your health maintenance here. It says that you had an annual physical here at the clinic, and they checked your foot for your diabetic foot exam last year. Is that correct?
Yes.
You also had it looks like a tetanus shot in 2011. Sound about right?
Sounds about right.
And you had a PPD test for the tuberculosis. It was negative. Is that correct?
That's right.
2011. Okay, and you also, it looks like you received the flu vaccine last year, correct?
Yes.
Okay, and I see here that you saw an ophthalmologist December of 2013. Is that correct?
That's about right.
Okay. All right, sir. So what type of work do you do?
I'm a supervisor at a restaurant.
Okay, and do you live in a house or an apartment?
2-bedroom apartment.
Okay. And are you exposed to any hazards or toxins in your environment?
No.
Okay. And looks like I have your past medical history. Your mother, she's 75, she has history of diabetes. Is that
Yes,
correct?
yes.
And it says here that your dad is 80, has history of diabetes.
Right.
And your sons, how are they doing?
They're well.
Okay. So it says here that you're married. How long have you been married, sir?
15 years.
Okay. Okay. And who do you live with in the apartment?
My wife and my 2 boys
Okay.
are 13 and 11 years
Okay. And do you have a religious preference?
old. Yes. Catholic.
Okay. And do you attend church regularly?
Yes.
Okay. And I know you said you've been feeling stressed at work. How long has that been going on, sir?
About 3 to 4 months.
Okay. All right. So just to review your sexual and reproductive history here, do you recall how many partners you've had, sexual partners you've had in your lifetime?
5
Okay. And do you have sex with females, males, or both?
females.
Okay. And are you having sex with your wife only, or are you having sex with others?
That's my wife though.
Okay. And do you or your wife use any contraception, like condoms or birth control?
No.
Okay. And have you ever had any histories of sexually transmitted diseases?
No.
Any problems with any sexual problems?
No.
Okay. Okay, good. Let's see. So, looks like your blood pressure is pretty good. The medical assistant took your vital signs. Your blood pressure is 106/72. That's really good. Based on your weight and your BMI, it looks like you're a little bit overweight. 26.9 is your BMI. And it looks like they did check your blood sugar, and your fasting blood sugar today was 173. So you know that's a little high. Normal fasting blood sugar for somebody like you who's a diabetic should be between 70 to 130. Okay, so we're going to go ahead and do your examination. Now we're going to listen to your heart. Okay, sir. Just going to go in here. Okay, your heart sounds good. I don't hear any abnormal heart sounds. You have a regular rate and rhythm, and I don't hear any murmurs, rubs, or clicks. So heart exam is normal. We're going to go ahead and listen to your lungs. I want you to take a deep breath in and out with your mouth open. Go ahead. Good. 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 Okay. Good. Now we're going to listen to the back of your lungs. Just going to raise this up a little bit. Okay. Go ahead and take a deep breath. Good. Deep breath. Good. Good. Okay, good. Your lungs sound nice and clear, sir. It's normal. So now we're going to go ahead and examine your abdomen. Just going to raise your shirt up. Okay. Okay, your bowel sounds are nice and active. There's no abdominal bruit. I'm going to go ahead and touch your stomach now, and you let me know if anything hurts, okay?
Okay.
Are you having any stomach pain right now, sir?
No.
Okay. Does this hurt?
No.
Does this hurt?
No.
Does this hurt?
No.
How about here? Does this hurt?
No.
Here?
No.
Okay. So go ahead and take a deep breath, sir. Okay, let it out. Okay. Excuse me. Go ahead and take a deep breath, sir. Let it out. Okay. There's no pain?
Okay.
Okay. Let me go ahead and help you up. So your abdominal exam was normal. Your bowel sounds were good. I didn't feel any masses. Your liver and your spleen were not enlarged. So now we're going to go ahead and examine your legs and your feet. Now we're going to go ahead and examine your legs. I'm just going to go ahead and roll up your pant legs here. Okay, so the color of your skin looks normal. Your skin is warm and dry. I don't see any discoloration, any dark discoloration. There is no edema or swelling. I don't see any cuts, any ulcers. I'm going to go ahead and move on down to your feet. The color looks normal, and they both feel warm to touch. Let's see, your dorsalis pedis pulses are normal. They're 2+ on both sides. Your posterior tibial pulses are also normal, about 2+. And I don't see any cuts, any ulcers as well. No cuts, no ulcers. Your nails look well trimmed, and I don't see any ingrown toenails. It's good to look between your toes to make sure that there aren't any fungal infections. Okay, so now we're going to go ahead and check the sensations to your feet. So I'm going to have you bring this foot up like so, and I'm going to have you close your eyes, and when you feel me touching your feet, let me know if you feel it and if they're both equal, okay? Let's see.
Feel it?
Yes?
Yes. Feel it? Yes. Yes. Feel it? Yes. 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 Yes.
Okay, so you felt it and everything was equal?
Yes.
Okay. All right, so now we're going to have you put your foot like this, and again, close your eyes and let me know if you feel it and if they both feel, if it feels equal, okay?
Yes. Feel it? Feel it?
Okay, everything equal?
Yes.
Okay, good. Now let's check the other foot. Okay, go ahead and close your eyes, sir, and let me know when you can feel me touching your foot and if it feels equal, okay?
Okay. Touch, yes. Feel it? 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 Feel it?
Okay, everything, you felt everything and it was equal?
Yes.
Okay, so let's put your foot like this. You go ahead and close your eyes and let me know if you can feel it and if it feels equal, okay?
Okay. 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 Okay.
Okay. All right. So your sensations on your feet are intact. So, you know, since you're diabetic, it's really important that you get your feet checked. And the reason is people with diabetes can sometimes have nerve damage to their legs and their feet. They can also have poor circulation. And on top of that, people who are diabetic tend to not heal as quickly or they can't fight infection as well. So it's possible that you could have a cut on the bottom of your foot and may not know about it. And that cut can progress to a severe infection, maybe causing severe damage to your foot that would require possibly an amputated toe or maybe amputation of your entire foot. So That's why it's really important that you check your feet. Okay?
Okay.
Okay, sir. So your exam was pretty good. Everything looked pretty normal. But I wanted to talk to you more about diabetes. Okay, so you know diabetes is a chronic, progressive disease. So that means it's not going to go away. There's no cure for it. And if you don't treat it, it'll only get worse. So I know you said you've been feeling good and that's why you stopped your medications. But you need to know that in the early stages of diabetes, you may not have any symptoms for years. And when the symptoms do appear, it's likely that major organs have already been affected. Okay, so you have type 2 diabetes, and in type 2 diabetes, your body's cells are resistant to insulin, or your body's not making enough insulin. Insulin is a hormone that's made by the pancreas, which is a gland that's located here near your stomach. Insulin allows the sugar in the blood to go into the cells to be used for energy. So when your body is not making enough insulin, or your body's cells are resistant to insulin, your blood sugar levels will rise. The complications of diabetes is a result of poorly controlled blood sugar. So in order for you to not get these complications or to prevent these complications, you really need to manage your diabetes better. So to get good control of your diabetes, you need to make sure you have good control of your blood sugar. And you can do this by taking your medications like you're supposed to every day. You need to eat a diet that's low in carbohydrates, avoid sugars, use sugar-free sweeteners like Splenda. And I mentioned earlier that you're a little bit overweight. Being overweight is a risk factor for diabetes. So you should exercise moderately every day for 60 minutes. Walking is a good example. Let's talk about the goals of diabetes. In the morning, your fasting blood sugar should be between 70 and 130. 2 hours after you eat, your blood sugar should be less than 180. Your hemoglobin A1C, which is a blood test that kind of lets us know how well controlled your blood sugar is, should be at or below 7.0. Now I want to talk to you about signs and symptoms of when sugar is too high and too low. When you find yourself being more thirsty, peeing more, or eating more, those could be signs that your blood sugar is high. So you should call the clinic because we may need to adjust your medications. If your sugar is 500 or over 600, you're probably going to need to go to the ER. Signs and symptoms of when your sugar is low: you may feel a little bit of a headache, you may not feel quite yourself, you may feel weak, tired, or dizzy. If your sugar is below 70, you should eat something, maybe a hard piece of candy, some juice, eat some food. If people around you or your family notice that you're not acting right, you're confused, maybe you're diaphoretic or sweaty, maybe you're unresponsive, they need to call 911 and get you to the emergency room right away. Okay, so regarding your high cholesterol, like diabetes, you need to take your medications like you're supposed to. You should also eat a diet that's low in fat, limit your salt intake. Again, you should avoid foods that are fatty and greasy and fried. You should also exercise to help lessen your cholesterol. Goals for high cholesterol. You should have your LDL, which is your bad cholesterol, less than 100. Your triglycerides, which is a type of cholesterol, another type of cholesterol, should be less than 150. The other thing that we've talked about is your gallstones. In order to prevent any pain flare-ups, you should avoid a diet that is spicy, greasy, or fatty. Regarding your stress, exercise and meditation will help lessen the stress that you may have. So you haven't been to the clinic for a year now, and you haven't been taking your medications for a year. So we're going to need to recheck your blood and your urine, your hemoglobin A1C to check how your sugar is doing, how well controlled it is. Check your liver, check your kidneys, your cholesterol level to see if you're anemic. We need to check these things before we restart your medications. Today would be a good time for you to go get your blood drawn because you haven't eaten anything today, because these blood tests would require that you fast. Once you get your blood drawn, you should anticipate a phone call from us in 1 to 2 days, and we can discuss the lab results as well as instructions on your medications. And one more thing, I'm sorry, I forgot about this. I should tell you about the complications of diabetes. This is very important. So, diabetes affects major organs. It can affect your heart and your blood vessels, meaning you could be at risk for developing high blood pressure, stroke, or a heart attack. It can also affect your kidneys and its ability to filter out the waste products in the blood. So you can have kidney disease, you can have kidney failure, and possibly dialysis. The other thing is that diabetes will affect your nerves. It can cause nerve damage to your legs and your feet. It can also cause poor circulation. Diabetes also affects the blood vessels in your eyes, so this can lead to blindness. So again, in order to prevent these complications from occurring, you've got to get a really good control of your diabetes. Eating right, exercising, and taking your medications, and making sure that you keep your appointments. So let's see. We want to see you in 3 months to reevaluate how you're doing with your diabetes, as well as your cholesterol. Make sure you make an appointment as well for your annual physical exam. And you are due to see an ophthalmologist, because remember, diabetes affects the eyes. So I'll go ahead and write a referral to that. And it looks like you're due for a flu vaccine. Would you like one, sir?
Yes.
Okay. All right. So I know we went through a lot of information today. Is there any questions you may have, sir?
No question.
Okay, so I'm going to go ahead and call the doctor, and we'll come back and speak with you.
Okay.
All right. Thank you very much, sir. Thank you.